I'm Dr. Anil Mishra. I'm Director of Cardiology at BM Birla Heart Research Center. Today I'm going to talk about how to differentiate between angina and gastric pains. Because a lot of people who are having heart attack, they think it is gas or gastric pain and they don't pay adequate attention to it and they'll end up with having a heart attack and then they end up very late into the hospitals. Angina, which is a lack of oxygen supply to the heart muscle, it causes a pain. That is what is called angina. Classically, it is on exertion. When you exert, suppose you're walking, if you walk after a certain distance, you get chest tightness, heaviness, discomfort, and that gets relieved by rest within minutes. This is a classical angina. Gastric pains usually do not relate to exertion, they can relate to food. So they will happen in any time, usually after a meal, and then when you take belching, etc., they get relieved, whereas angina does not. Do remember, angina can also happen at rest when there is a very severe tight blockage, and then we call it unstable angina. So you will not be able to differentiate that from a gastric pain on the basis of temporal relationship to exertion. But in general, anything which comes on to during exertion and goes away with rest is likely to be angina. You get it evaluated by a doctor. Gastric pains are usually when you have been fasting for too long, or immediately after a meal, or we have had a heavy meal, and they often get relieved by antacids. Many people do take gelusil or other kind of antacids, even desi preparations like podinhara, etc., and which gives them relief. So that could be gastric in nature. I think there is enough information here for you to be able to differentiate between the two in general. But in either case, if you're not sure, and particularly if this pain lasts for longer than 20 minutes, do seek medical help. Do not leave it to yourself to decide what it is.